Could the Pap test used to detect cervical cancer become a thing of the past? There are new screening recommendations from the FDA, and here to discuss those recommendations, Dr. Scot Ackerman, one of the First Coast's leading oncologists. He joins us every Friday to talk about important health issues, and this is one of them because these recommendations just came out, and it affects obviously a lot of women who thought one thing was okay, but now it might change our philosophy going forward. But first, let's talk about the standard screening for cervical cancer. What is in place right now so that we feel like when we go in to get tested that we're being protected?
Thanks, Casey. The current test we have now is called the Pap smear. I'm sure every woman's heard of the Pap smear.
Yes, we sure have, and we enjoy that experience immensely. We won't get into that.
I hope you enjoy it because it'll diagnose cervical cancer early, and it saves lots of lives.
Right.
It's been around for over 60 years, the Pap smear. It's a wonderful test. In that it is able to find abnormalities in the cervix, and it has made cervical cancer or deaths from cervical cancer a thing of the past. Before the Pap smear was around, many women unfortunately died of cervical cancer, but with the Pap smear, we're diagnosing cervical cancer early, where it can be treated and cured. The cure rate for cervical cancer right now is well over 90%. Now, what we recommend currently, the guidelines from the American Cancer Society, is that all women who are adults get Pap smear periodically. Those women in their 20s should get it every 3 years, and women in their 30s and above every 5 years. Now, there's other organizations like the Gynecological Organization or the Gynecological Oncologists or the American College of Surgeons, and they have a little bit different recommendations. Some recommend that the Pap smear be done more often than others. And so what I recommend to patients that ask me, I recommend they talk to their physician about the Pap smear, about their risk of cervical cancer, and have the Pap smear done at an interval that's appropriate for them and their overall health.
So how does then the FDA why do they want to change the screenings, and how are they going to change the screenings going forward?
Well, as it turns out, with the Pap smear, there's a lot of the time the Pap smear shows abnormal cells. They're not really cancer cells, but they're abnormal cells. And we do another test called the HPV test. And what the FDA did was they commissioned a panel to look at the recommendations for cervical cancer screening. And this panel voted unanimously, in fact, to replace the Pap smear with the HPV test. HPV is human papilloma virus. We've talked about that before. So what that means is if these recommendations are accepted and if they're folded out, then women over the age of 25 would only be tested with the HPV test.
So why then would the HPV test be then better than the Pap test that we are currently getting?
So the Pap smear looks at abnormalities in the cells, and the HPV test looks at the HPV virus in the cervical tissue. So it turns out 99% of cervical cancers have HPV in them. So we have determined that the 99% of cervical cancers are caused by HPV. There's certain strains of HPV that put a woman at higher risk. HPV 16, HPV 18. If you have HPV, it doesn't mean you're going to get cervical cancer.
Okay.
But if you have cervical cancer, most likely, 99% of the time, it's caused by HPV. Remember, many women have HPV, but very, very few have cervical cancer.
Okay.
So the FDA is recommending that we do the HPV test to identify those women that are at high risk for cervical cancer.
Okay, so I'm just hoping that when you test for this HPV, that they found some way that you can just like rub a lotion on the skin or something, or just do like, you know, like blow your nose in this Kleenex. You know, that's how we're going to be able to test for this. Do we have to go through that uncomfortable Pap smear type test to do the HPV test? I mean, bottom line, how do you test for this?
Yeah, sorry.
Okay, no, same thing? Okay.
Sorry, same
I thought
thing.
we would luck out a little bit.
So the same thing, it's a pelvic examination, and the physician or the practitioner takes a little swab of a big Q-tip, if you will, and takes a little bit of sample, and that sample is then evaluated. A lot of times, the gynecologist or whoever's doing the pelvic exam will do a Pap smear and a HPV at the same time. So they do a little scraping for the Pap smear and a little Q-tip to get a specimen for the HPV.
So do you recommend then when we go in to see our gynecologist that we get both of those tests in one fell swoop, or one or the other, or not get the Pap test, or what?
I think for right now, it's good to get both of the tests. I would not discard the Pap smear. I think that having HPV test on top of the Pap smear gives us a little bit more knowledge. And so if there's some abnormal cells, you know how serious it might be. So my recommendation is that women, again, always speak to their physician, but I would recommend when you get the pap smear, get the pap and the HPV at the same time.
Okay.
And we'll see what the FDA recommends.
All right. Thank you so much, Dr.
Thank you,
Ackerman.
Casey.
Appreciate you, sir, as
Good to see
always,
you, sweetheart.
talking about this, and thanks for sponsoring this segment. And remember, if you have any questions regarding this topic or any other health questions that you might have, you can visit Dr. Ackerman's Facebook page, which is simply facebook.com/First Coast Oncology.